In the first section, let's start with the cellulitis and nasal deformities. In this, we will talk about what cellulitis is and how it presents if there is cellulitis of the external nose, and then different abnormalities of the shape of the external nose, in which we will talk about the saddle and hump nose, and then two other deformities like crooked nose and the deviated nose. First, the cellulitis. Cellulitis is the inflammation or infection of the tissues. So mainly the cellulitis is caused by the bacterial infections of the streptococci and staphylococci. So when the skin of the nose, here in this diagram you can see it's the whole area, external nose is affected as a result of the infection caused by the streptococci or staphylococci. These are the round-shaped bacteria, streptococci and staphylococci. And this causes cellulitis. It's a very, very painful condition, and there is tenderness and pain associated with fever also. So cellulitis, causative agent, streptococci and staphylococci. There is red, swollen and tender nose. If you see, this whole area is affected and the nose become very red, swollen and tender. Extension of infection from the nasal vestibule. These areas here, this is the nasal vestibule. So this infection mainly it spreads or extends from the nasal vestibule. So we have these are the two nares or nostrils. In between we have the nasal septums, which is the partition that divides the nose into two halves. And then the inner portion, these are the nasal vestibules. So it's spread from the nasal vestibule. Treatment is antibacterial because streptococci, staphylococci are both the bacteria. The hot fomentation is very helpful to reduce the swelling and the tenderness, and then analgesics are effective. If there is too much pain, usually the analgesics are effective to relieve the pain. So cellulitis is the inflammation of the tissues, and usually it spreads from the nasal vestibule and cause pain, swelling and tenderness of the nose. Then one deformity of the nose is known as the saddle nose. Here if you see this, there is a depressed nasal dorsum. There is depressed nasal dorsum and it can affect the bone or the cartilage, or both bone and cartilage can be involved. So here there is depressed nasal dorsum and may involve bony, cartilaginous or both the components. Here, saddle nose. Usually the cause of the saddle nose, if there is any injury or trauma to the nose, it can cause depression and depressed nasal dorsum. Excessive removal of septum in submucosal resection. So septum is the portion that divides the nose into two halves. So if the removal of the septum, if it's removed excessively in resections, usually it can lead to the saddle shape or saddle nose. Destruction of septal cartilage by hematoma or abscess. So all these are the different causes of the saddle nose, in which there is depressed dorsum of the nose, and this can be due to trauma, due to excessive removal of the septum, or destruction of the cartilage by hematoma or abscess. Next, the hump nose. Here, if you see, this is the hump nose as the humpback when there is excessive bulge of the back. This is the hump nose, in which there is excessive bulging here. So bone cartilage, as like saddle nose, bone cartilage or both bone and cartilage are associated with hump nose. Treatment is reduction rhinoplasty. Rhinoplasty is the repair. Rhino is the term used for the nose. Plasty is the repair. So reduction rhinoplasty, in which there is reduction is done to remove this hump of the nose. So reduction rhinoplasty, in which there is exposure of nasal framework by careful raising of the nasal skin by vestibular incision. So raising of the skin and exposure of the nasal framework. Removal of hump and narrowing of the lateral walls. So when the hump is removed, the lateral wall becomes wide. There is widening of the wall. So after the removal of the hump, the walls should be brought together to remove that widening. So osteotomies to reduce the widening left by the hump removal. So reduction rhinoplasty is performed. After rhinoplasty is removed, then the widening of the lateral walls is performed by osteotomies, and then it can be removed. So here, if you see, there is removal of the cartilage or the hump. Next is the crooked nose. This crooked nose is mainly the midline of the dorsum of the nose from frontonasal angle. This is the frontal portion or frontal forehead, and this portion is the frontonasal angle. So anything that causes deviation to the midline in the C or S-shaped manner leads to crooked nose. Here, this instead of midline, if they are angled differently, form S-shaped or C-shaped, this can lead to crooked nose. So midline of dorsum from frontonasal angle, this is the angle, to the tip is curved in C or S-shaped manner. Traumatic injuries sustained during birth, neonatal period or childhood can lead to crooked nose. Deviated nose, also known as DNS, deviated nasal septum. This is the septum that causes partition. Here, if you see in this septum is deviated. Also, DNS is the term used for this, deviated nasal septum. Midline of dorsum is straight but deviated to one side. So it's straight, but there is little deviation to side. DNS or deviations can cause conditions like rhinorrhea and sinusitis, and there is constant infections. So DNS or deviated nasal septum is usually treated by the surgery is performed. Rhinoplasty or septorhinoplasty. So rhino is for nose, septorhino is for the septum of the nose, and repair is performed. So that was all about section 1, in which we talked about the different deformities of the nose. Thank you for watching sqadia.com.